think of a hormonal imbalance, we often think it's a woman's issue. Not so. More and more men are turning to their doctors for help. And Dr. Oz, I know you've talked about this. I mean, there are effects that they have on men, too, hormonal deficiencies. I mean, they need to look into it if they're feeling kind of lousy. Women are always complaining, but men have issues, too, right?
Well, there are some categories where both men and women suffer equally.
Yeah.
Weight gain, loss of memory, problems sleeping. You know, these will affect both genders. But the guys really have a problem with libido. And erectile dysfunction and, you know, all those things that a guy spends a lot of time thinking about, they get messed up when the hormones aren't functioning correctly. The women's cycle is an interesting place to live because it's pretty regular for a reason. You can't afford much variability with women. Otherwise, you can't have babies.
Right.
But for men, a lot more variability is tolerated, so it's much more difficult sometimes for us to figure out when things aren't functioning correctly. It's a much broader range of what normal could look like.
Yeah, and it's not, they may think, well, there's something wrong with me or my relationship, but it could actually be something physical.
Women usually blame themselves 80% of the time, where it turns out that 80% of the time it's not the spouse, it's actually your hormones that aren't functioning correctly.
Wow, I can only imagine how many difficulties that can present in a marriage and, you know, your relationship, and they can do something about it. Men should look into their hormone levels just like we do. Is it testosterone that's low then? Testosterone
is the most common problem that we identify. Okay. It's relatively easy to fix. There are creams you can take for it, for example. One other little tip for men, whenever you have a big belly, if your belly size, the circumference of your waist is more than half your height, pretty much for sure you're converting some of the testosterone, which is normally made in your testicles, into estrogen. So even if you naturally could make enough testosterone, that fat will prevent you from actually using it. And of course, you lose your libido, you lose your ability to make muscle, so then you gain more weight. So a lot of guys just need testosterone for a short period of time, and with that help, they begin to lose weight. Once the belly fat goes away, you don't need it anymore.
Well, that's interesting. So, and I know we've talked about hormones with women. It can start as young as your 20s. Is it the same for guys? If they notice?
Same for guys.
Because I know, you know, young kids sometimes have those issues too, or they have like
the first thing to look for, if your body isn't feeling right to you, are your hormones. Your hormones are like the thermostat in your house. You won't quite know that it's not the right temperature, but your body can tell you. And so, for example, if you start to gain weight in an unexpected way, if you can't sleep normally, if your hair starts to get fizzy, you just don't look the same as you used to look. The first thing to look for is the thyroid gland, and then the sex hormones. Again, for men, testosterone; for women, estrogen and progesterone. And they manifest themselves in very different ways, but they're both eminently fixable.
Yeah, and I think a lot of us just say, well, we're just getting older, it's just part of what my grandparents went through, and we just write it off and we suffer through it.
You said it perfectly. That is the biggest mistake folks make. They think, you know what, my best years are behind me. I've done it all. I guess this is supposed to happen. Change that today. That's not how it's supposed to be. And if you haven't looked at your hormone levels, I have to assume they're not normal. Because there's so many different things that change it. The toxins, the environment, the stress of your life, issues with how you sleep, your workouts, all that will affect your hormones. Why take a chance? There's some things in life that are knowable, Lisa. Some things are not knowable. This is one of those knowable realities and treatable.
Those are very good to know so people can start, you know, feeling a lot better. And hormones play such a critical role in how we feel, as we just said, and when people find themselves with a deficiency or an imbalance, remember there are ways to get back on track. Arizona has a pioneer in natural hormone replacement therapy, and Kyle has more.
There is a natural way to return you to the balance and well-being of healthy hormone levels. Here with more is Dr. Gino Tutera, the founder and medical director of Sotapelli Therapy and leader in bioidentical hormone replacement therapy, along with his patient Meryl Osmond of the Osmond family. Welcome, you two.
Good to be here.
Thank you for being here. Now, Dr. Tutera, let me start with you first. With Meryl sitting right here, do you tend to find that more men are coming forward seeking treatment for hormonal replacement or therapy?
Absolutely. There's so many men that are just like Meryl that have had a loss of energy, a loss of libido, a loss of mental alertness and clarity, and they're now coming out because of the fact that they're either their wives are telling them there's a problem, or like Meryl, they are seeking help for their condition.
Okay, and Meryl, how did you find Dr. Tutera? Tell us about your experience.
Well, I've researched a lot of people. I've taken the salves, I've taken the shots. This is the only thing that's worked. He's given me back my life.
Seriously?
Absolutely.
So things were not great before?
Well, I was just so depressed and I couldn't sleep. I was gaining weight. I'm losing weight. I'm having better time. So the whole thing has just changed my life completely.
That's really great to hear. Now,
absolutely.
Dr. Tutera, I hear that the delivery method of Sotapelli therapy is very unique. What's so unique about it?
Well, this is the only form of therapy that allows your body to control the release of the hormone through the action of your heart. So if this is a pellet and you place it underneath the skin, as your heart pumps blood across that pellet, your body becomes like a kid licking a lollipop so that you're able to deliver hormone, more hormone when you need it and less when you don't. Let me just show you what the pellets look like. This is what we basically implant.
That's it?
Just little bit, even these little bitty things.
Oh, that's so small.
Yep, and this is probably about a 6-month supply of hormone for a woman. And for men, you need more pellets, but our pellets are specially formulated to be able to work with the heart so that it delivers hormone the right amount at the right time.
Oh, that's incredible.
Yeah, it's incredible.
Meryl, if you know somebody watching, if there's some females out there that notice their husbands are acting a little differently, or maybe they feel like they could use something like this, what would be your advice?
Well, every guy that's watching, I mean, come on. I mean, after 40 years of marriage for me, this is the thing that'll put your marriage so much closer together. I mean, you'll feel like a teenager. I mean, you really will. And I'm not just saying that. I mean, I've really been through it now, and I know.
That's incredible.
Absolutely.
Now, you have a book and some special offer you'd like to share with us, right, Doctor?
Yeah, I've written, several books on the subject, and right now we have a special offer that if someone comes in and mentions Dr. Oz, that we give them a $30 discount to come in and off their consultation, so they can come in and be able to afford themselves the ability to get this therapy.
That's incredible. Well, thank you so much.
Well, thank you.
Very good. Thank you both for being here.
Thank you.
Now, if you want more information about the Sotapelli therapy, you can go to their website, sotapellitherapy.com, or call the number you see right there.